I'm just getting over I'm coming through the end of a flu of some sort, so I don't usually look like Raj Binder, but that's why I asked to go last and had to move me way down here. When Kate asked me to talk about brain health or prevention, I said I think what I'll do is just tell people what I tell them in my office. You know, in this day and age, one of the unfortunate problems with going to the doctor is a lot of times the expectation or attitude is, well, surely doctor, in this day and age there must be a pill. And in some ways healthcare has become very much directed at what is the pill, what do you write to fix this problem. And I think what we're going to hear is that's not the right approach for this illness.
Not yet.
And what I tell my patients actually is one of the reasons we can't fix dementia is because we can't do brain transplants. And that's because the underlying problem of dementia is that the brain cells are dying faster than they're supposed to, and the resultant loss of brain tissue is the underlying reason for the functional losses we see. And so I suppose if someday comes that we can do brain transplants, maybe we could fix this disease for sure. And I'll give you the advice I give all my patients: if you're going to get a brain transplant, just make sure the donor was a politician so you get a brain that wasn't used. See, that used to be a blonde joke, but I got in trouble, so I had to change it. So when I tell people about dementia or about memory loss, because not everybody that has memory loss has dementia, and a significant number of people that I see who have memory loss have what we call mild cognitive impairment, which in and of itself, in a few circles, is still up for debate, but considered somewhat of a pre-dementia condition, and any research that's been done would suggest the medications for dementia do not help mild cognitive impairment and actually make things worse. And so when we talk about any illness, including dementia, I usually tell people there's two ways to treat any illness. There's medicines, and then there's everything else. And the everything else, particularly for mild cognitive impairment, dementia, memory loss, even healthy people, every one of my patients, male, female, young, old, gets told you need PMS. And most of my patients have no idea what PMS is. That generation didn't talk about those things. The daughters usually snicker and laugh, and I look at them and say, it's not that PMS. Men can't get that kind of PMS. They might suffer from it, but they can't get it. PMS for seniors means physical, mental, and social activity. And there is all kinds of research suggesting and showing the benefits of physical, mental, and social activity towards the brain. And it would seem, if the volume of research is any indication, that physical activity seems to be the one with the biggest effect. There's been an explosion of research on the physical benefits towards memory disorder, towards treating dementia, toward preventing dementia. There's been a bit of work done, and I don't know if John, you're going to talk about this or not. There, at least for a while anyway, there's a little chemical our brain makes called BDNF, which is a little chemical whose job it is to help maintain the integrity of the brain cells. Levels of BDNF go up when you exercise. And maybe that's why exercise helps protect your brain. But when I talk to my patients in my office or in their home or wherever I see them, we all hear about physical, mental, and social activity, and these are not just things that you can do to say, oh, well, I think I'm doing something. These are every bit as much of a treatment of and prevention of dementia as me giving you a prescription for Aricept or Remenil or Exelon. And you know, and if you don't have the illness, then I'm not going to give you a prescription anyway. So this is the prescription. And as Toby was saying, you know, physical activity doesn't have to be, you know, your Lululemons and your headband and your bag and your water and everything and go to the gym. I mean, physical activity can be as simple as walking every day. And I tell people, shoot for 30 minutes a day of walking. It's great fun to see some of the, especially the little old ladies, who say, oh, doctor, I can't walk, my knees are so arthritic, and so I tell them to go to Aquasize. Well, that gets a great response. Me in a bathing suit, are you kidding? But really anything that you know, doing your day-to-day housework, doing your chores around the outside, you know, all of this stuff. My father-in-law's uncle once commented that he was amazed at the number of people that had treadmills in their basement and riding lawnmowers in their garage. You know, I mean, something as simple as mowing the lawn, or I mean, there's lots of physical exercise right there. Mental exercise, reading, puzzles, cards. I mean, everybody in this island seems to know how to play Auction 45, right? Scrabble, Sudoku, all of those things are good for your brain. And then social activity. We were designed as social creatures. We do much better when we socialize. There are some studies that would suggest that people who are better socially connected stay in their homes longer than people who are less socially connected. And so when you talk about the one thing every patient agrees on, it's that they never take me up on my offer of a nursing home bed. Would you like to live in a nursing home? I don't get any takers. Can you imagine? People want to stay home. And I tell people that's part of my job, is to try to help you do that as long as possible. And physical, mental, and social activity are the biggest things people can do for themselves to try to achieve that. I think that's pretty well everything I needed to say about that. So I think, is it question time?